Welcome to PCR London Valve 2024. I'm Gemma McCalmont. I'm a nurse consultant at James Cook University Hospital in Middlesbrough, and I'm delighted to be joined here today by Sarah Carson, who's a nurse at Royal United Hospital in Bath. So Sarah, I'd like to just ask you a quick question about what you think is the first step in ensuring a safe discharge for patients.
Well, Gemma, I think a safe discharge begins with your pre-assessment of the patient. So you know their comorbidities, you know their family setup, you know any barriers to discharge before they even come into the hospital. And by doing that appropriately and with the right steps, you can break down any barriers to start with before they even come in for their procedures. So you're almost anticipating with the patient and their family how they're going to be discharged, when they're going to be discharged, and what to expect when they're discharged, so the family can have any setup ready for them on the day or the day after their procedure, depending on your discharge protocol. So we're assuming our patient has come in and had a lovely smooth TAVI procedure with no complications. How can we facilitate that early discharge that we're striving for?
So I think when we think about moving from the peri-procedural phase to the post-procedural phase, we really need to ensure that we can recognise early complications to ensure that that phase of recovery is smooth and facilitates the discharge process. And for that, we need to ensure that staff know how to recognise the complications. Even though they are less frequent these days, we still see them.
Yeah.
So the staff need to be educated around how to recognise complications and also how to manage them quickly and efficiently. We also need to think a little bit about the patient recovery. So thinking about an accelerated recovery with a rapid return to the patient's baseline mobilisation. So thinking around the topics that fit into that, we might think about early mobilisation of the patient. So aiming to mobilise the patient within 3 to 4 hours of the procedure, so that they can spend less time as a patient and more time feeling independent. And I think that really builds into the confidence that the patient feels when we do then talk about discharge home, because they've already been moving around the ward area comfortably and safely before they then transition to that home environment. So Sarah, I'd like to sort of talk a little bit about what we did in our session, and we worked here on a criteria for discharge. And thinking about that, what would you say the key points were to ensure that?
So it was an amazing session, Gemma, wasn't it? It was so interesting to get everybody's ideas together in one place and to pull them all into one hopeful discharge document. And I think there were some threads that ran through for all valves, you know, that the patient has to have a straightforward procedure, any complications are dealt with, that they return to baseline observations, there's no prolonged ECG pauses or anything that we would be worried about sending the patient home, but also that they've returned to normal mobility, that we've thought about their ongoing education, so do they know what to expect in the weeks and days ahead? We talked a little bit yesterday about an easy week where you are discharged, but you are walking around the house and doing easy exercise and then stepping up your exercise programme, which I thought was quite interesting, you know, because sometimes you send people home and say have a rest, but very clearly yesterday the whole group felt that we should be getting people back to normal activity as soon as possible, reviewing their medications, ensuring they understood what their follow-up was and their families were on board with all the care, their ongoing care that they were going to have. And the patient understanding that they had had a successful procedure, but also that they would, you know, how they would feel in the few days going home and how they would feel in the weeks ahead. And that piece of work that we did yesterday, amazing piece of work we all completed yesterday, will be available online for everybody to have a look at, which I think is amazing that, you know, when I get back to my institution, I can get the girls to log on and have a look at the great piece of work that was achieved.
Absolutely. I think that's an amazing resource for anyone that's thinking about sort of setting some criteria to support discharge, so that we can have a streamlined process and also something that's standardised in our approach, which is really valuable for people who are caring for these patients in hospital. So with that, Sarah, I thank you for your contributions today for this discussion.